Welcome. Thank you for joining us today. I appreciate everyone joining us for this special session of our cross-industry update around COVID-19. Today's topic is vaccination. To start, we will have live interpretation. So there is an icon on the bottom, a little globe that allows you to move to live interpretation in Spanish. Berenice, would you like to?
Buenas tardes a todos, amigos. Si están escuchando esta grabación, no estamos en Facebook, pero si están escuchando, por favor, hagan clic en el globito que dice Interpretation en la parte de abajo de Zoom y elijan español para que puedan escuchar esta sesión en español. Yo voy a compartir el link de Zoom en nuestra página de Facebook de Latino Chamber para que estén al tanto. Y también vamos a compartir la grabación en español una vez que terminemos el evento. Gracias por asistir. Adelante, Corinne.
All right, thank you for joining us. We will start today with a series of speakers, and I'm going to actually start today by introducing Laura Woods with Employers Council, and she's going to cover a lot of the questions we get around, can I mandate vaccines? Can I ask about vaccines? What line can't I cross? What happens if they say no? What happens if they can't? So we're going to start with those questions because we know we have a lot of questions around that. And then we're going to move to the public health side and some more updates there. So Laura, why don't you start? And then we'll make sure we have both interpreters in the interpretation room.
Thank you. I'm glad to be here today. I do want to say I have a fair amount of information to cover in a short amount of time. So as questions come up, we will keep track, but I do want to give time for the other speakers. So we'll address questions at the end if we can, or we'll make sure that we get the answers to you after this session. So just kind of a heads up there. So I work for Employers Council in Denver, and we consult employers really in all the Western states on employment law, employment related issues. And we are getting inundated daily and have been all since, for over a year about mandates and questions, and specifically about vaccinations. So most of our members are asking the same questions. Can I ask if employees or candidates are vaccinated? Can I require employees to be vaccinated? Can I incentivize our employees to get vaccinated? Can I punish employees for not getting vaccinated? And I'll say for the most part, the answer to all those questions is yes. The CDC, the EEOC, everybody who's in charge has said for the most part, yes. In my opinion, the bigger question is, how do I do this? How do I do these things? How do I ask? How do I require? How do I incent? And what are sort of the restrictions or things I have to think about if I'm going to make this requirement? And that's a bigger, sort of longer set of answers that I'm going to try to do justice to here. And then we're going to go over the last question, which is, what if employees refuse? So the first question is, can I ask employees or candidates if they are vaccinated? And really the answer for the most part is yes. There are two sort of governing laws around this. The first one is called the ADA, or the Americans with Disabilities Act. And the second is HIPAA. And I think we've all heard a lot about HIPAA. So I want to kind of dispel some of those HIPAA myths as well. So first, ADA. The EEOC and the CDC has said that employers can ask about vaccine status and they can ask for proof. However, the ADA requires that employers maintain confidentiality of employee medical information. So if you are asking for proof, like a card or a picture of the card or some sort of doctor's note, you have to keep those just like you would any other medical record. Generally, they recommend that that's separate from a personnel file. And you have to make sure that people understand that, like all medical information, it's going to be stored privately, and that there will not be many people in the office that will have access to that information. The other thing is that if an employee is not vaccinated, or a candidate is not vaccinated, and they tell you that when you ask, it's a good idea, if you're going to ask follow-up questions, to make sure none of those questions would get to information about a disability, right? Or about genetic information, which is also protected. Finally, it's really a good idea to have a written policy in place, so that when you do ask about vaccinations, you can back it up with your policy. You also want to tell employees that they don't have to provide anything besides the proof. They don't need any extra document besides that vaccine proof. There's really no other information that's necessary. On top of that, let's talk about HIPAA. I think that tends to be a confusing issue for both employers and employees. I think that when an employee throws out the word HIPAA, or the acronym, employers tend to back off, right? Because they think that they can't ask. So HIPAA, the acronym, is actually for, and this is going to be long, so I'm going to apologize to the interpreter right now, the Health Insurance Portability and Accountability Act. That P does not stand for privacy. It stands for portability. And the law in and of itself really mostly applies to medical providers. It applies to medical providers talking about medical issues between a patient and the provider. From an HR, from a business perspective, from our perspective, HIPAA only applies to your health benefit plans and medical information that's related to the plan. The exception to that is if you operate and administer your own plan in-house. So if you don't have a third-party provider and you are self-insured, then yes, you would be subject to HIPAA in the same way as a plan would be. But again, this does not apply to asking whether somebody's vaccinated. Asking about somebody's vaccination status has absolutely nothing to do with the care being provided to an employee that's covered by a health plan. Or that's related to a health benefits plan. So I think that's really important to know. Again, the EEOC and the CDC guidance both say that employers that obtain health information about employees are not required to comply with HIPAA. You must comply with the ADA that we've already talked about, and genetic information is also protected. So you don't want to get any information about, previous illnesses or genetic issues. But today, in the age of COVID, people seem to think that HIPAA prevents you from asking whether they're vaccinated, and that's not true. Really, the ADA regulates the record keeping around all of it, but that's all you need to worry about when it comes to asking. The next thing I want to talk about is requiring employees to be vaccinated. The question is, can I require employees to be vaccinated? And again, for the most part, yes. The answer is yes. Literally a half an hour before this started, there was an announcement that Joe Biden is going to require COVID vaccinations for all federal workers and contractors. He had done that before in a previous executive order. The new executive order is not going to allow testing as an acceptable alternative. So this is news, and he's doing this. He's going to allow this, and this was huge breaking news just like half an hour ago. So you can require vaccines in the workplace. The first thing is that you do want to think about whether or not this is specifically job related. You also want to think about whether you're in an industry that is legally required to require vaccines. So right now, for example, in Denver, most Denver County, employees and including the school district, everything, they have to be vaccinated, and they have to be vaccinated by a certain time. So you may be under a local or a state order about vaccines, and those all differ. So you definitely want to be aware of that. If you're not an employer that's under one of those requirements, you get to decide whether you want to make that requirement or not. You also get to decide whether or not you want to require it for all employees or only public facing employees or whatever. And so that's really important. So the first thing you want to do is you want to create a policy that explains to everybody what you're doing and why you're doing it. Again, if you're legally required to do it, you can just put that in the policy under this requirement, under this public health order. This is a requirement, etc. The other thing you have to think about, however, is that there are a few caveats. One of the conversations that we're having right now is around accommodations. You may need to make accommodations under the ADA, the Americans with Disabilities Act, or for a strongly held religious belief, a sincerely held religious belief. So you will get employees that are applying for an exemption under either the ADA or the religious exemption. My advice is always to make sure that you are consistent in your practice. You don't have to automatically approve those. You do have to go through what's called an interactive process for every request. You have to do them one by one. If you're a member of Employers Council, you can give us a call. We can walk you through it. If not, I recommend that you work with your corporate counsel, your HR department, or an employment law attorney to really understand that interactive process. Know that an employee asking for a religious or an ADA accommodation does not have to be granted automatically. You do have to be consistent in that process in when you approve or deny those. One of the pieces of information I've seen recently about the religious exemptions is one thing to look for is if you had an employee that was asking for a secularly related exemption and then all of a sudden needs a religious exemption, you can kind of look at whether that is what they consider a strongly held belief. So that's something that you definitely can take a look at. The EEOC says that employers will be acting consistently with the ADA as long as any screening implemented is consistent with advice from the CDC, public health authorities, and for that type of workplace. So really, again, yes, you can require it. There's going to be some administrative considerations. You should have a policy. And as you're going through the accommodation conversation, especially for medical accommodations, may I recommend what's called the Job Accommodation Network. It's JAN or Ask Jan. They have an amazing website with specific COVID-related possible accommodations. So you don't have to make that up either. There's resources there. OSHA also has some really good COVID-related information. So you've decided that you want a vaccine in your workplace. You've decided that maybe instead of requiring it, you're going to try to incentivize it, right? Are there incentives? Can I incentivize vaccines? Under the ADA, and really, yes. The straight up answer is yes, you can. There's not really any sort of things around it. You can offer an incentive to an employees to go get one, or you can offer an incentive to employees and you can provide it in your workplace. Again, if you are administering the vaccine, you can't, well, in both cases, really, you can't offer an incentive that is so large to be coercive, right? So what I tell my members is no flat screen TVs. How large is too large is really kind of determined in the courts. So for now, I'm going to recommend gift cards, coffee cards, and maybe an extra paid day off, something that doesn't make it so hard to say no that they could say they were coerced into it. Also under GINA, under the Genetic Information Act, you can offer incentives. And this is per the EEOC on their questions and answers. You can provide incentives for employees to get vaccinated. You cannot provide incentives for employee family members to get vaccinated. You can, however, offer if you're doing it on site, to have employee family members vaccinated, but you can't offer an incentive for them to join in on that. So that's kind of an important distinction. The last kind of thing I want to talk about is, so that's the carrot. Can you punish employees? And one of the ways that is really in the news right now is increasing insurance premiums for your unvaccinated employees. You may have seen that United or Delta just recently announced that they're doing this. Is it okay? Yes. The answer is probably. It may go through some litigation for some more concrete guidance, but for now it's okay. I will say, if you choose to go this route, you want a few considerations. First, you'll have to change your plan or your plan document. So you'll need to work with your insurance provider or your broker to make sure that you work with them to change it before you announce any changes. And then you want to consider your culture. Really, this is a punitive move. And is that the culture or the employment brand that you want? That's no right answer. There's just some considerations. I will say that so far, the data is showing that it's been very effective for Delta to encourage their employees to be vaccinated. The final question, and my final little bit, is what if an employee refuses to wear a mask or get vaccinated? And it really depends on your policy and sort of all that information we've already talked about, right? If it's the law that you have to provide or you have to vaccinate your employees, then really termination is your option. You certainly can terminate employment for people who aren't complying with the law, right, as an employer. Otherwise, if you've decided to create a vaccine mandate within your organization, you have to decide what your punishment or what the consequences will be. If you have to be consistent in your practice, you have to be consistent in your enforcement, and a well-written policy is going to help with that. So that is my high-level answer. Really, for the most part, yes. And I'm happy to answer questions later again in the program or after the fact.
Thank you, Laura. I appreciate your update. And we have a bunch of questions to ask you. I think we'll get to those later. But first, I'm going to move to Lane Drager with Boulder County Public Health, who's going to facilitate more of the other speakers that we have on today's panel, a little bit about some of the vaccination programs and vaccination requirements, and more information about some of the other regional areas. So Lane.
Thank you, Corinne. So I'm going to introduce some of our partners that have joined us. So Danica Lee is with Denver, and Melissa Sager is with the TriCounty Health Department. And we're going to start with Danica, and she's going to give you kind of a synopsis of what the Denver program's approach is and how they're approaching vaccines. Danica, go ahead. Thanks.
Thanks, Lane, and thanks to our great partners for holding this event. I think great information is being shared here, so happy to join. I am the director of one of our divisions at the Denver Department of Public Health and Environment, which is our local accredited health department. I'm also the deputy public health official overseeing our city and county of Denver COVID response. So I'll start by sharing some information about our current vaccination mandate in Denver. We announced in early August a requirement that will be in effect by September 30th for personnel in certain settings to be fully vaccinated. So first and foremost, our 13,000 plus city and county of Denver employees must be fully vaccinated by September 30th. And then we also identified a number of higher risk settings, both in terms of high risk for transmission and also for fueling community spread. And that includes different types of clinical settings, care facilities, hospitals, limited healthcare settings, shelters for people experiencing homelessness, correctional facilities, schools and childcare centers, any entity providing home health care, and then first responders as well. So this was a pretty broad measure here in Denver. And of course, it has not been without challenges and bumps along the way, which we're continuing to work through. And I should also say, we have defined our city personnel to include all contractors and subcontractors. So anybody who's working on a city and county of Denver project, or is under contract with the city and county of Denver in any way. So pretty broad, because we are really trying to take measures that will help us preserve our economy and hopefully keep us from having to take pretty restrictive measures like we saw last year. So that's our thought process there on requiring the vaccine mandate. And because it's so effective, we know that it is very effective in minimizing the worst outcomes for people with COVID. We have, of course, been receiving a lot of questions and have tried to provide a lot of resources to different people and organizations subject to that Denver mandate. And so I'm going to talk about those here real quick on our website, and I'll either send this to Corrine or put the website in the chat here in the Q&A chat. We do have quite a few resources. We have frequently asked questions, which are changed and added to on nearly a daily basis. And we also have an online toolkit that covers a lot of the same information that we're talking about here today, but of course is specific to the mandate in Denver. But I think that information can also be really helpful to employers who are considering a proactive requirement within your organization, regardless of whether you're subject to a public health order requiring that. So hopefully those resources will be helpful. We do get a lot of questions about exemptions. And so with our public health order in Denver, we're being very clear that a medical exemption has to be supported through documentation from a physician or clinical provider. And also a religious exemption, similar to what you already heard, needs to be based on a sincerely held religious belief and not just a opposition to, a desire to not be vaccinated. And so, of course, we're managing all of that both for our own workforce in the city and county of Denver, and then also with these external organizations that are subject to the vaccine mandate. One question we're getting a lot right now for our mandate is, with our deadline of September 30th coming up, what does a good faith effort look like? And our businesses to expect that there could be enforcement actions. Our goal is not to take any enforcement action. We really want to, we recognize that this is a huge endeavor and requirement, and that there's a lot of coordination that has to occur. So generally what we're letting folks know is that if the September 30th rolls around and you have not, tried to initiate collecting information about the vaccination status of your employees, that does not constitute a good faith effort. It doesn't mean that October 1st, you need to have addressed everybody who's either not approved for an exemption or not vaccinated, but you should certainly have a pretty good documentation to support whether your workforce is vaccinated and who is and who isn't. And then we're further communicating to entities subject to our public health order that they should, after that September 30th deadline, within that next week, they should be engaging in a process to hold that staff member accountable to the requirement. Looking at our own workforce, again, with the city and county of Denver, we are anticipating that we will be pretty prompt in initiating those conversations and taking some action. And while we certainly hope to minimize any attrition of employees, it is possible, one of the possible outcomes for our own city and county of Denver staff may be separation, being dismissed because they, if an employee is not willing to adhere to the policy of our employment organization as the city and county of Denver. Let's see, one other thing I'll share just from the standpoint of an employer that is working on this effort right now. There's of course lots of different ways you can go about trying to collect documentation to support any requirement that you might have in your business, whether it's a proactive one or because of a public health order. What we did in Denver, we have an application called Workday. That's kind of our personnel management and HR management cloud-based software. And we created a little module in that where you upload a picture of your vaccination card. So that's one example of an approach that can be used, in Denver, again, because you have to have that documentation on site if you are subject to our public health order. And then one other thing that we are doing as an employer as well, we do have some staff who are kind of vocal about the fact that they're not currently vaccinated, and it's causing quite a bit of anxiety in different workplace settings. And so we have taken the measure of, for anybody who is not vaccinated, they do need to wear a face covering in indoor settings in the workplace. I know some jurisdictions that are represented here today already have a broader face covering requirement indoors. So there is, of course, some variation jurisdiction to jurisdiction right now. I think I will pause there and pass it back to Lane and to others. Thank you so much.
Thank you, Danica. Now I'm going to turn it over to Melissa Sager with the TriCounty Health Department to kind of share some of the activities that TriCounty has been working on.
Thanks, Lane, and thanks for putting this together, such a huge resource. I won't repeat lots of things that Danica and Laura said earlier. I will say we're in a little bit of a unique situation in TriCounty. So that's Adams, Arapahoe, and Douglas counties, in that we do not have a vaccine requirement. With that, federal requirements have been mentioned. The state has requirements in place as well, and we are prepared to help businesses with those requirements. We will be doing some proactive outreach within our counties to businesses, certainly encouraging vaccine mandates, providing connections to information, like the information that was presented earlier. You can do this, you're encouraged to do this. How can we help you? How can we connect you with additional resources and get your questions answered to operationalize a vaccine requirement within your business, whether that be for your employees or customers coming into your business. So keep an eye out for information from TriCounty. Don't hesitate to reach out. You can find our contact information on our business support page, which is tchd.org/business support. You can also just Google TCHD business support and it'll pull that page up. So we're actively working on resources for our businesses. We're available to answer questions and connect folks to resources now, and we'll be building out those guidance materials, supports, webinars, things like that in the coming weeks. So keep an eye out for that information, and don't hesitate to reach out if you have questions. Lane, back over to you.
Thanks, Melissa. I will point out that our regional partners have been wonderful about sharing resources, so we intend to collaborate and continue to share resources across the region as folks are developing information that's going to be helpful to you to implement vaccine programs. I think that the common link is the vaccine is our most essential tool, and we're all looking to try to further improve our vaccination rates, across the entire state. That's the most important step we can all take. I'm just going to share a few slides, mostly on some links and resources of what we're doing in Boulder County. So just bear with me one second. All right. So the first thing I wanted to mention, so Boulder County, as many of our peers, have put public health orders in specific to our school kind of childcare settings. So that's one thing that is requiring masks, as an additional strategy for prevention of COVID. But recently, Boulder County also put an order that applies to all indoor spaces. So the only exceptions are really your private residences. So, and that is for all individuals 2 and older. So that was a big additional piece that has happened in Boulder recently. And one of the nuances within that order also provides some opportunity for folks that have put full vaccination programs together. We're kind of terming this creating a vaccine passport. So for programs that have done that, and we'll make sure that folks have this link if you haven't seen it already to our page. that would allow folks to potentially not have masks in their setting once they have a fully vaccinated program, meaning all of their staff, the folks that they work with, patrons, are vaccinated. Then that facility could have their masks removed. So again, a lot more information on that. We already have sort of an interim program.
I mean, I hate to break in there, but your presentation is zoomed way in, so we can only see 3 or 4 words.
Okay, sorry. I have 2 screens going, so let me see if I don't know how to get them out. Let's see. Well, that's a problem. Let's just stop. See if there's another way I can do that. Yeah, that is, and now it's doing that on my own screen. So
I stopped you now because nobody can see what
no
you're
problem.
doing.
So we'll share the links to that information. It's not really essential that you see it, but we'll have a link to our page. We are allowing businesses that already had vaccination programs. You know, we've had a lot of businesses that have been proactive, set up a lot of these policies that Laura talked about, where they already are requiring not only their staff, but again, all of the patrons and folks that they work with to be vaccinated. So for those folks, we have allowed them to continue with their process and then also not have to mask while we fully develop our vaccine passport program, which we hope to have launched by the end of September. But that website is again the portal where those folks that already have those programs in place can continue to attest to us that they already had that information and can continue to operate. So we aren't looking to stop folks that have already been proactive while we're fully vetting our program. So more information can be found there on that website. And so I really encourage folks to look at that. But vaccines is the tool. We know that folks that haven't had programs have thought about this. So that was one of the impetuses for this webinar, was to make sure folks had resources for those people that have been thinking about this. We are trying to provide it, I think, as an additional incentive for those that can really develop this full vaccine passport that would allow you an exemption to the mask order requirement. We know that that doesn't mean you're completely at no risk. So again, we really want to look at the types of settings and what kind of additional mitigation strategies might be important to implement. But it will require you to submit an application that will be reviewed and will need approval to continue once the full program goes into place near the end of the month. One of the things that we've seen from folks that have already implemented these kind of programs is an additional resource on how you can verify people's vaccination status. So we wanted to mention the My Colorado app. So that is an application developed by the state of Colorado, and it has a number of nuances where you can load your identification information into this app. And one of the options is your vaccine status. So it accesses the Colorado immunization system, so the SIS system, where it will upload your vaccine card. So that is a very simple, easy way for folks that have a mobile phone to be able to share their vaccine status, again, for businesses that are going to go down this road. So again, one of the requirements of our program is to verify vaccine status. So it is not just okay for people to say they're vaccinated, they would have to show some proof. And this app is a very simple way for folks to be able to do that.
Lane, do you mind if I really quickly show the website with that app so people can see what it looks like?
Please do.
All right, so on this website, My Colorado, it is downloadable through the App Store and Google Play. And individuals can get their driver's license, their fishing cards, their registrations all into this one app, but it also has the My Vaccine record, which then pulls up your vaccine record and is available to be able to show venues. So I'm going to stop sharing, but I just wanted to show people what it kind of looked like. And then the site is the My Colorado.
Yeah, thanks, Corinne. The other things that I was just going to mention are resources, and we'll provide links that Corinne can share out with all the attendees. So we have our dashboard that's has a lot of information for folks that are interested in seeing where things are at with the disease. We have links and resources for businesses. We have a whole host of resources that we want to make sure folks have. There's also statewide information that's, I think, also very important for folks to know. This is definitely a worldwide pandemic, so there are no bubbles that are protected. So we are partnering very closely with our regional partners because we know what happens in our jurisdictions influence the other. So we also are working closely on how we develop policies, so we have consistency and we can each use best practices to build off of those. With that, I think we can, save the bulk of our time for getting into kind of questions that hopefully our robust attendees have brought with them.
So we did have quite a few questions that were asked and answered in the Q&A because they were specific to the Boulder County mask order. I'm going to ask a few of those in some more general terms, just to make sure that everybody is aware of some of the answers. But first off, I have a couple questions for Laura. So Laura, come back up on screen. We have some questions for you. And these came up during your session, but
Here I am.
yeah, there you go. So Danica did mention subcontractors as well, but there are questions about whether you can require a subcontractor to be vaccinated, a 1099 employee or a subcontractor to be vaccinated, and whether you can incentivize a subcontractor.
So because that's not actually an employer-employee relationship, right? It would be a subcontractor of your contractor, or you would have that relationship with that group. You could certainly add that to the agreement that you have with that contractor, that anybody that they hire needs to also be vaccinated. And so it's not a handbook thing or an employee thing, but it is something that you can absolutely add to the contract and the agreement that you have with that worker.
All right. So this question is about, so we've talked a lot about asking for proof from your employees. This may not be for you, Laura. This might be for the public health folks. But can you ask clients about their vaccination status? What is the current status of that? Because we're talking about employees, but some of these facilities would like to know if they can ask their clients, their customers, their guests, their vaccination status as well.
I will say that I'm going to defer to the public health folks for that one. I try to stick to the employment relationship, so I don't want to speak out of turn.
I don't know if we have any attorneys. Generally, I'll punt questions like that to our legal representation.
We do, Trina.
I can answer that. CDPHE actually has on its website a very helpful FAQ that states, I'm sorry, I'm trying to pull it up so I can quote from it. The FAQ states that, yes, you can ask for a customer's vaccine status. I will put that FAQ in the chat and the language of the FAQ so that you have it.
And in that FAQ, they also talk a little bit about, yes, you can, and then where that's covered and where it's not covered. So anything that's put in the chat today, I know I've had some people respond that they cannot copy and paste. I will send out all these links as well as a recording of this video to everybody that's on today's call and anybody that registered, as well as the general audience of business recipients that receive my emails within the Boulder County area. So I just wanted to point that out so everybody's not rushing to write everything down really quickly. So that question about clients, we'll make sure. Can an incentive, Laura, be as large as a raffle, similar to the raffle of the state of Colorado did? Now, we always have to be careful with that raffle term because raffle license, but a drawing, could it be similar to what the state of Colorado did with those large drawings?
I think that would be a good incentive, and I don't know that there would be a problem around that. I want to, first of all, I want to say, I want to do a little bit of research just to make sure that I've got all the information on that, and I'll make sure that you have that so that you can send it out after. That is something that we discuss in other employment issues, and this is not related, but in terms of maybe getting employees to sign up for direct deposit, for example, that you can create a drawing for that, and that's never been a problem. I don't know why that would be an issue, and I think it's a great idea if that's what you want to do. You look at your budget maybe and the number of employees that still need to get vaccinated. You may have a budget to just provide them all with, coffee cards or a day off instead, and then you're more consistent in your practices. So that's something to consider too.
Another question for you. I'm just going to keep you going. Can
Sure.
you make vaccinations required for all new hires, but not necessarily for existing employees?
I wouldn't recommend it. Again, you have to think about the jurisdiction you're under, right? So if you're legally required to provide vaccination for all your employees, then that question is moot. However, yes, you could. I would ask you why you would. I think you would be creating an us and them culture. Also, the point is that, as Lane said, the vaccination and the more people who are vaccinated is really the point, right? It's about safety and it's about getting people vaccinated. So you've got this us and them, your current employees aren't required, your future employees are. That's not going to create a good dynamic. And it doesn't answer that question of just getting people vaccinated for the safety of your employees. So could you? Probably you could. You'd have to provide a good business reason why you would do that. And I don't recommend it. I don't think it serves the purpose.
All right. And then one more question for you, and then I have a couple questions for public health folks.
You got it.
Read this one a little bit. I'm going to read this one a little bit closer to the question. But let's say a company has they're a small, closely held company. It could even be a large company that believe all but one staff is vaccinated. How can you incentivize this person instead of punish them? They just gave this person a raise when everyone else has already complied. People's busiest seasons are coming up and they want to make sure that they don't get impacted by one unvaccinated person in their office. So what are some best practices around maybe incentivizing this person instead of punishing while everybody else has complied?
I think this goes maybe less towards incentives and more towards a conversation. I think that one of the ways to talk to people who are hesitant around vaccines is to, instead of judge or trying to push, just really hear why they don't want to do it. Talk to them about the actual, talk to them about facts. Make sure you're talking about the CDC and the FDA and all the things that have happened. Really, I think this is about a conversation. And if you decide that you want your entire workforce to be vaccinated and that person absolutely digs in, at some point you have to make a decision as to whether or not you are going to allow one exception within your workforce. And I would say, again, I don't recommend it. And so if you've tried all the incentives and that doesn't work and you don't want to try, some sort of stick, I think you either have a conversation or you have to decide that this may not be the right place for this person to be working.
If you let somebody go or fire someone because they don't get a vaccination when you have a vaccine mandate, do they qualify for unemployment?
Maybe. That's a maybe answer. I think that what I advise my members when they have unemployment questions is anybody can apply for unemployment, right? So under any circumstance, whether it's related to vaccines or not, they're going to apply for unemployment. It's then your job to provide every piece of factual information you can to the unemployment department, to the DOL, about why you think they shouldn't. And then the state gets to make that decision in the long run. You can always appeal that decision, but it's not really in your power to make that decision. It's in your power to provide all the information you can to help the state make that decision.
Thank you, Laura. I'm going to now move on to a little bit of some of the public health questions. So we know that there's a vaccine program or a fully vaccinated facility program being implemented in Boulder County to incentivize businesses to have vaccine mandates. And so there's a few questions around that program. And so I'm going to ask a couple of those questions, knowing that, you know, there might be other programs in TriCounty or Denver or other areas. And this is because Boulder County does have that indoor mask mandate. So as far as the program goes, Lane, I know that, you know, some people are getting the temporary approval at this time, and then the full application will be available later on. Can you or Trina talk a little bit about what's being talked about as far as the 12 and under population? What's going to be, just how you're going to decide about, you know, under 12 who cannot get vaccinated? And Trina, I know you answered this in the Q&A, but I know a lot of people have this question. It'd be good to ask it. And it might be for any business that has a vaccine mandate, you know, since under 12 cannot get vaccinated.
It's a really great question, and I'm sorry I don't have an answer for it yet because we're still working through the details of the program. I would encourage folks, if they have some input on that, to share that in the chat, and we will certainly review it.
Can you talk a little bit about the idea that under this fully vaccinated program, that it may be available to have certain times where everybody is masked and then certain times when you are maskless because everybody in the facility is vaccinated, that there is that piece that's allowed?
Yes, that is such a great question. And I encourage facilities that may be a little hesitant to implement this program because they think that it might affect everyone in their, well, let me put it this way. The program is meant to be flexible. So if you are a gym, you could offer a class, say your noon class, and say your noon class is going to be a fully vaccinated class. And everyone who shows up to the noon class must show their proof of vaccination. And everyone during that noon class can remove it. And then at other times of day, you could just follow the regular mask order, which is the default, and everyone must wear masks regardless of vaccination status. So this is meant to be a flexible program to accommodate the specific needs of different businesses. And that's part of the reason it's voluntary too. But if you decide maybe this isn't quite right for me all the time, but maybe, you know, at certain times of day, I'd really like to have a fully vaccinated class, then you can apply to the program just for those certain times of day. And you just need to be very clear and very specific about when you have a fully vaccinated facility and when you do not, because we can't mix masks off with not requesting proof of vaccination. There is no full vaccination or mask permitted here, which I know has been a source of confusion. It's either you're a fully vaccinated facility all in during that time in that space, or everyone masks.
Yes, we've seen a lot of confusion around that. So the mask order in Boulder County is anyone 2 or older. You know, there's not a, if you're vaccinated or not, it's masks, or if you're a fully vaccinated facility, you know, you can have the no masks during that time. All right, so I'm gonna keep on you just one more time. Can you apply for this fully vaccinated facility if you have a couple employees who have vaccine exemptions or so forth? What would be the policy under that?
Yes, so we recognize that businesses may have legal requirements, for example, under the Americans with Disability Act, to provide exemptions for certain employees. The expectation is that your policy would allow for those exemptions that are required by law, and you would still be eligible for the program, certainly.
Okay, so I'm going to ask somebody else from public health too. We do get a lot of questions about what's the protocol if an employee has been vaccinated but reports being exposed to COVID and they happen to come back with a positive result. I know there's still a lot of questions about this quarantine and isolation, and if you're vaccinated or not. Can maybe Lane or Danica, well, I think all I have left is Lane and Danica. Will you cover the piece around if you are vaccinated and report being exposed to COVID and or you get a positive result?
Yeah, so it's really important at that point for the person that is now identified with COVID to isolate. So they should not be at work. They need to follow all those protocols. We'll make sure that Corinne has the links to all that information. But that is really important. And then it also is important to cooperate with public health, who's likely trying to do those case investigations and contact tracing, to look at high-risk exposures, which could possibly be in your work setting. So if that person was sick and symptomatic, or just during their point where they're contagious and they were at work, there could be additional coworkers that could be exposed. There are some different protocols depending on whether you were masked and whether you're vaccinated. So again, we'll make sure Corinne has all those nuances so people can look at it. But there still is a risk for vaccinated folks. You know, that is not a hypothetical situation. There are breakthrough cases, and Delta has created a much higher rate of that than what we've been dealing with over the last year plus. So it is very important for folks to look at that. And then those high risk exposures would need to quarantine. And so again, we'll make sure all those guidelines are shared with Corinne. So again, at that point, now we're in a very reactive mode. So it's not in that prevention side. We need to make sure we stop that spread and don't have things escalating into large outbreaks. So we do need those folks to isolate to prevent that continued spread, especially to their coworkers and patrons. So,
Danica, did you want to add anything?
I guess I could just add that, you know, if you are fully vaccinated, meaning you've had 2 doses of Pfizer or Moderna or 1 dose of J&J, then you don't need, if you're a close contact of somebody who's a confirmed case, you are not required by public health at this time to isolate or to, you know, stay away from others, but you know, use common sense. Wearing a face covering is a really smart measure and actually is part of the guidance for vaccinated close contact. And then if you can easily avoid being in large groups of other people, that's certainly a preference. Getting tested at around the 5-day mark, 5 to 7 days, is also a good measure. So the guidance that's posted on the state health department's website on most local health departments goes into that detail too.
Great. And then again, if you have a positive case, whether you're vaccinated or not vaccinated, you need to isolate, period. And I had shaking yeses. So on a recording,
That's
the
correct.
shaking yeses are yeses. All right. So this is kind of a topic I saw a couple email chains about today, but someone put in a question that they are offering a vaccine incentive program and an employee submitted a card they think is fake, where the vaccinations were given 2 weeks apart. There were some questionable pieces to the card. How do they verify the vaccination card is legit, or is there a method that they need to go through if they think they have a fake vaccination card in front of them?
We mentioned the My Colorado app. That would certainly be a way to get a valid information, because that is pulling from the Colorado database that has all the immunization records. So what it does, and Corinne had shown that screenshot, is it's pulling the actual record from the database versus a card. We know that people can buy blank cards online, sadly. We don't expect that there will be a lot of fraud, but that is at least one tool that's in place that's accessing databases of immunization records to share then an electronic record. You can also potentially ask for immunization records from physicians if that's, you know, was potentially where they went as a provider. Yeah, we also have some additional information in our public health order on the types of verification that we're requesting folks do.
One other thought, and I'll speak to Denver here and not to any other jurisdictions. In Denver, you can contact the local public health agency. Depending on the specifics of the situation, we may or may not be able to help investigate that issue. But you know, if you reach out and share specifics of your situation, we can provide further guidance.
We will share a link that Corinne can blast out, is if there is really fraud, and pretty confident that people are doing things fraudulently, there is a contact that will, I think, do some of that investigative work at a larger level. That's not something we're investigating here at a local public health level in Boulder County, but we do have some links to reference folks to where they're concerned about fraud.
Thank you, Lane. I'm going to ask the next two questions of Laura. These are compensation questions. So first question is, do we need, as an employer or a business owner, need to compensate an individual should they choose not to be vaccinated and contract COVID and have to isolate?
Most likely, yes. In Colorado, we have the Healthy Families and Workplaces Act, which provides for paid time off for COVID-related issues while we are under a public health emergency. That public health emergency can be local, it can be state, and it can be federal. Right now, we are currently under a federal public health emergency, regardless of any of the locals. That is good until the middle of October as of right now. Healthy Families and Workplaces Act is you're required to provide that time off for 4 weeks after a public health emergency ends, again, any one of those. So the earliest any of that is not going to be required anymore would be the middle of November. The federal government has been updating those quarterly. I would think they will be updating that and extending it again in October right now.
Thank you. And so can you also speak to, so this includes that quarantine time as well. So it's not just the isolation, but also quarantine time. Can you talk about that? And then is there a requirement to give paid time off for vaccinations?
So any time off under quarantine or any of those COVID-related issues, or if you're caring for somebody who has COVID, or even if you have a childcare issue, is covered under the Healthy Families and Workplaces Act. So, and we have resources on our website that I can also provide and links to that information. And of course, there's always the Colorado website in terms of the HFWA. And then the second one, tell me your second question again. I'm sorry.
Time off for vaccinations, because this webinar is about vaccinations. There's a question about that.
The time off for vaccinations, I believe, is also covered under the HFWA. It is also covered under the FFCRA and the ARPA, which are federal laws. Those are voluntary right now, and the ARPA actually expires at the end of September. We haven't had any indication that that one's going to be extended, and you have to voluntarily be participating under the ARPA. But in Colorado, again, under the Healthy Families Workplaces Act, yes, yes.
Okay. Can you require to have copies of employees' COVID vaccination cards on file? We heard Denver saying that employees are uploading vaccination cards. Can you require this piece?
You can, or a copy of it, clearly, right? You're not going to take somebody's actual card. You can. Again, I always recommend consistency in your practice. So if you're going to ask it for one, you should ask it for all. And that information is covered under the ADA in terms of private. So it would have to be kept in a medical file that's separate from the personnel file, and made sure that it's not public information for the rest of the company.
Okay. And then I think there's one more that I can ask you about, and that is if you've been exposed to a child in your household that you're caring for who tested positive for COVID and you've been vaccinated, how long do you have to, oh, maybe that's not for you. How long do you have to quarantine for, Elaine? I think you're my sole public health person still on.
So again, we'll share all that. Was that for a vaccinated person?
For vaccinated. And what I'll do is I'll share the link to a really great graphic that Boulder County Public Health put together, which is if you're vaccinated, it's kind of a flow chart on quarantine and isolation. And I've sent it out a couple times, but I will send it out again because I think what it does is give you that visual representation of the if this, then this. And if it's not covered under that, then we can answer it under the call center line.
Yep, oh, that'd be great.
Okay, this one's for you, Laura. Any idea how much longer health insurance companies will be covering COVID tests?
That's a really good question. That was really sort of covered under, again, the FFCRA. I'm using acronyms and I'm sorry. The FFCRA and the ARPA. And I will say that once those expire, those may not be covered under insurance. I would have to look up, that might be under the public health order. I'm very sorry, Corinne, but I would like to look up that answer and get that to you later.
No problem. We will send that out. I appreciate your research on that and your candidness about not having the answer right on hand.
You bet.
So for the Boulder County businesses that would like to apply for the fully vaccinated facility exemption, can you one more time, either Trina or Lane, clarify this idea of days or times in which a facility could be a fully vaccinated facility, and then those off times when everybody, including those that are vaccinated, need to wear masks? A specific question, for example, was could we have days in which everybody wears masks because that's the day our unvaccinated staff come in, and then days where we are maskless because those are the days that vaccinated staff come in?
And I'll just answer very generally that we would encourage anyone who has a program to apply. We will definitely review each individual case. But what we're going to be looking at is, have you eliminated the risk of exposure for unvaccinated folks in the setting and activities that you're planning? So it isn't a hard and fast rule that it's days of the week or times of the day. It could even be a specific location within the facility. You know, if the entire facility, you have to have masks until you reach this room, and now this room is only vaccinated, and then people take their mask off. So it's not an all or none in that sense, but it is not an individual opt-in, opt-out. So again, it's not at the door we check people. If you're vaccinated, you don't have to wear a mask. If you're unvaccinated, you wear a mask, and then you go about commingling. So it really is the activity and locations where you're going to be removing masks. Everybody needs to be in a vaccinated status that has been verified. So there could be a lot of scenarios within that people propose that we will absolutely review. And again, if they're really managing that, then they would likely be approved.
And one of those scenarios I've gotten a lot from retail, or some of those that serve the public, or maybe when it's just your staff and all your staff are vaccinated and your doors are locked and nobody's coming in, then it's maskless because your entire staff is vaccinated. But then when you start to accept clients in, then everybody is masked. That's when we get a lot. Would that be one of those scenarios where you'd want to mitigate the risk to the unvaccinated and make sure that it's clearly outlined?
Yeah, I think so. You would have to have, again, a process where you know when clients are going to be in there. It can't just be somebody notices that somebody has walked in now and oops, everybody needs to grab their masks. So it would need to be, controlled, and people would know that maybe if they only saw clients during certain times of the day. But again, we would encourage you to put your program together and submit that when we're open for accepting those applications.
Will all of the guidance on the fully vaccinated facility program be available in Spanish as well, including the application?
Yeah, that is our intent. So we're actually actively working on the interim program to have that application in Spanish. So we're trying to make sure all of our resources are available.
What happens between now and when the program begins on late September?
And those facilities that already met the qualifications have been allowed to fill out the form attesting that they are meeting all those requirements, and they've been allowed to continue to operate as they were until we are then going to accept the full applications, at which time they would need to reapply. Otherwise, as we're waiting for that program, we're happy to work with folks who are needing some assistance. That's going to be one of our goals, is to help facilitate folks into this program. So we'll continue to meet with the business community and share where we're at in that process, as well as get feedback on does this sound workable? Does it sound like something people will be able to pursue? We don't want there to be significant barriers that prevent people from being able to do a program like this.
I don't know if you can answer this, Trina, and we're not going to put you on the spot as the sole lawyer on the call, but somebody asked if we were all vaccinated and we're approved for the temporary exemption or exception, not exemption, exception, what is our liability if someone still gets COVID?
Unfortunately, I can't answer that. You're going to have to go consult your lawyer about that one.
I knew that would be your answer, but it was better coming from you than me on that one. So there's a little bit of a question about the racial and socioeconomic equity related to normalizing the idea of a passport when it comes to the BIPOC population. You know, what are some of the conversations that are happening in that arena within the Boulder County Public Health and others to address some of these concerns?
That's a good question. Right now, we've connected initially with our economic development partners, which is representation across the county. We are interested in everyone's feedback. We certainly don't want to tag or label anything that creates barriers. So if there are concerns about, you know, calling it a vaccine passport, we definitely want to make sure we address those, because the idea is to get people vaccinated and allow them some additional flexibility in their life, not to create programs that are barriers to that.
And I've actually, you'll notice I don't use the term vaccine passport in this whole webinar. I've used the fully vaccinated facility term because it's about the facilities at this point, but I do think that there needs to be an outlet for people to address these concerns as well. And we'll definitely provide that if there is, if and when it is available.
We appreciate that. And I think one of the reasons we wanted it to be broader than facility, because it needs to include those patrons and guests and the other people outside of the facility. So again, it's for the broader community as well, and that full interaction. So
I think some of the last questions have already been answered, specifically around the under 12. The answer is we don't know yet. And then some of this might involve the times of day or the how you apply as a facility, maybe. So those questions are being covered and being discussed. And once we have the answers, it will be put out on the webpage under the Q&A and under the application. There's also more questions about specifics on if I have a 10 o'clock class and 11 o'clock class, can one be vaccinated and one not? What about the air? I think those are some of those pieces of the application that businesses need to think about as they're applying, and they can ask those specific questions also to the support, to the email. Do we have any final things that anybody would like to bring up? I want to thank Lane, Trina, Laura, and our guests from Denver Public Health and from TriCounty Health Department for coming on today and sharing very valuable information around vaccination incentives, requirements, what you can and can't do, what are some other places, what are other people doing, so that you can know where those resources are and you're not recreating the wheel. Anything from Lane, Trina, or Laura that you want to cover?
Corinne, I did want to address in the chat, there was some confusion about the facilities and what that means. I think this is probably an event venue. The way we've designed the program is either an event venue can apply or an event organizer can apply. It's either or. And the idea is that if the event venue applies, then all of the policies and all of the proof and verifications is their responsibility. If the event organizer applies, then all of those things are their responsibility. So, it's meant to be flexible. If an event venue doesn't want to take that on, they can ask their organizers to do those applications for those specific times and places. But I think that raises a great point, because what if you want to be a fully vaccinated event venue, then how do you address your specific events? And I'll definitely take that feedback back.
So for example, I'm the Boulder Chamber, and we've decided that every one of our events requires, vaccination, which at this time we have not. So please don't quote me on that one. We could apply as the Boulder Chamber, knowing that we are collecting the vaccination information of all of our paid, our guests that are attending the events and so forth. But then there's the venue side. So I appreciate you covering that. We had some come into the chat, and the chat started going long. Lane, Laura, anything else? All right.
I just want to thank you for having me again. I always enjoy doing these with you guys, and I really learn more from other panelists too. And so it's such a benefit, honestly, to me as well.
And as a reminder, Laura will be providing, we have a tape recording of her, but there are answers to the questions that I asked her that will also get translated into Spanish to provide as a resource to individuals on the call and not on the call. Lane, anything final from you?
No, just a big thank you to the Chamber, to the Latino Chamber, and Laura and the other speakers, and for all those that took time to attend and that may watch this in the future. And we're happy to be a resource to continue to help folks be successful.
As a reminder, if you're in Boulder County, our next seminar or webinar will be in 2 weeks. On the 23rd, we will do the regular data update and answer questions that come up at that time. It'll be the Lane and Corinne show again. We won't have all these extra guests, but we appreciate everybody joining us. In the meantime, the call center is open. You have your different resources that you can contact, and we will get the links and information out to everybody. Thank you and have a wonderful, safe day.